Hi, it's Michael Gallagher, physical therapist. In our last video, we talked a little bit about the different types of back pain, um, musculoskeletal pain versus neurogenic pain. What I want to talk about today is, one, pain. How do we treat the pain from a low back injury or low back discomfort? Many ways. My first question that's asked in my office is, do I use hot or do I use cold? Should I use an ice pack? Should I use a moist heating pad? Should I use a hot shower? And the answer is yes. There's not a right or a wrong. General rule of thumb that I like to use, if you're having discomfort, soreness, tightness in the musculature, many times I choose to use moist heat, a hydroculator pack, a moist heating pad. Moist heat versus dry heat in that it penetrates more deeply and lessens the chance of burning yourself with a hot pack. Hot bath, hot shower works great if you're able to get in and out of the tub or in and out of the shower. Ice, just as effective, just as good at relieving back pain. Generally, when I use ice in my clinic, it's for somebody who's having an acute muscle spasm, a tightness, a fasciculation in the paraspinal musculature of the back. Again, there's not a right or a wrong. Find what works best for you. Many people have gone to using portable electrical stimulation devices. In the physical therapy office, we have large machines that allow us to do high voltage galvanic stimulation, interferential stimulation, all trying to decrease muscle spasm, decrease pain, increase blood flow to the musculature. On the market now are small units called TENS units, TENS standing for transcutaneous electrical nerve stimulator, something that's been used in physical therapy for a long time, now being sold in your local pharmacies. The biggest misconception is that TENS many times is confused, or patients think they can substitute a high voltage galvanic stimulator or an interferential current unit for a TENS unit. No, you can't. It's a very different animal. But not to say that these cannot be effective. A TENS unit or one of these small portable units are fine, especially when you can't get to your physical therapist office for treatment. Can now be purchased online. We no longer need a prescription for these units. They usually come with 2 to 4 pads, which can be placed in the area of pain by following the directions. There are some indications and contraindications for use of these units, so you always want to read the manual and speak to your healthcare provider before using them. But how is this different from a larger unit that you may see in the physical therapist office? A TENS unit is really just that, a pain relieving modality. It doesn't have the same physiological effects as some of the larger units. But in that, our goal today is to decrease pain. Fine to use one of these units. We'll place 2 pads on the back or along the leg or along the area where there's pain. And the way this unit works is to try to mask the pain. Briefly, the way it works is on what they call the gate theory of pain. The nerves in the body which carry pain are big, thick copper wires. Pain travels very slowly from one place to another in the body. Vibration, hot and cold, temperature are carried on very thin A fibers, or almost like a fiber optic cable. If we can overstimulate those fiber optics, if we can overstimulate those fibers which carry vibration, they arrive at the spinal cord faster or first before the pain signal can get there. The area in the spinal cord known as the substantia gelatinosa, the transfer station between the body and the brain. So picture we place this TENS unit or vibratory unit on there, the skin feels a tingling sensation, these small fiber optic cables send a signal to the brain. There are so many signals going to that area, carrying that vibratory sense very quickly, faster than those pain fibers. It actually closes the gate. It shuts off the pain. So again, not to be mistaken, the pain is still there, but sometimes we have to get rid of pain just so we can rest, just so we can sleep at night. So that's where these units do play a role, and especially at a time when we can't seek professional care. So once we've decided on hot or cold, If we have a TENS unit around the house or we decide to go out to the pharmacy and buy one, that's great. That's going to help acutely get rid of our pain, whether it be neurogenic or musculoskeletal. What I want to talk about today is some simple stretching and strengthening exercises you can do even if you can't determine where the pain is coming from. So some of these exercises will address both flexibility and strengthening as well as supporting the spine. So once again, I have Shannon here with me. So the first exercise I like to do is what they call a Williams flexion exercise. There's two general theories on treating back pain. There's multiple theories, but the two general ones that you see in most clinical therapy facilities today are the Williams approach or the McKenzie approach. Williams believes that most things should be done in deflection, bringing the knees towards the chest. McKenzie is a big believer in extension. Everything should be with an extended spine, opening up the vertebral column. I don't think one is right and one is wrong. I think we have to use a combination of both of these theories to best treat the back and treat the individual patient. So I'm going to have Shannon lay down for me first. And the first thing we're going to show Shannon, we're going to do with Shannon is address her flexibility issue. When you have back pain, your back tends to become very tight. So we're going to do what they call a Williams flexion exercise or a single kneaded chest exercise. I have Shannon laying comfortably on the table. I'm going to have her bring her knee up to her chest, grabbing with both hands, and gently pulling back to her chest for a count of 5. Does that feel okay? She's going to hold for 5 seconds. She'll feel a strength in her gluteal region, in her low back. Many people say this feels like it's stretching out my sciatic area, my sciatic notch. Another term which is used kind of synonymously with neurologic back pain. I have sciatica. Sciatica, by definition, is an irritation of the sciatic nerve. Many people describe any radiating or radicular pain going down the leg as sciatica. As I said, for today's purposes, we're treating the pain. Doesn't matter where it's coming from at this point. And switch. What I usually have my patients do is do 15 repetitions, alternating right and left leg, going to a point where they feel a stretch but no discomfort. I'll tell people to do this in the morning before they get out of bed. Do it before they go to sleep at night to help to loosen up the back. Some patients who have knee problems find it's easier to grab underneath the thigh and not on the knee. Either way is effective. Again, this is usually a little bit easier if you have a history of knee discomfort and knee pain. So that's known as a single kneaded chest exercise. We'll do from there, we'll go to what they call the double kneaded chest exercise. Never bringing both knees up together, but bringing up one side, immediately the other side, grabbing with both hands, and giving a pull. Again, feeling a stretch along the entire lumbar spine. Holding for 5 seconds, and down, and repeating 15 times. So I generally tell my patients, start with single kneaded chest. Try that for a day or two. See how it feels, and then you can progress to doing it bilaterally or both knees together. Stretching exercise. Let's talk about strengthening in this position in the Williams program. Another way of taking some of the stress or pressure off the low back is called the posterior pelvic tilt. What a posterior pelvic tilt is rocking your hips or pelvis posteriorly. So what I generally instruct the patient is I'll place my hand under their back or a small towel and have the patient push into my hand, up with your back, push into my hand, and tighten up your abdominal muscles at the same time, almost if somebody was going to hit you in the stomach. So pushing down into the table, pushing the small of your back into the table, and holding for a count of 5. 2, don't forget to breathe. 3, 4, 5, and relax. So basically causing a posterior rotation of the pelvis, but at the same time starting to strengthen the abdominal musculature. As I said to Shannon, don't forget to breathe. Most people have a tendency when they're doing an exercise to do what they call a Valsalva maneuver, to hold their breath, to really hold in tight. The thing I tell my patients is, if you're counting aloud, the air has to come out. That means the air is going in. It'll force you to breathe. So once again, you're going to tighten the abdominal muscles, push down into the table, and count aloud. 1, 2, 3, 4, 5, and relax. Good. You can sit on up. So simple start. Having back pain, we want to gain a little flexibility, a little mobility as well as starting some strengthening. We'll start with some Williams flexion exercises. On our next video, we'll talk a little bit about Mackenzie and his theory of extension, and then we'll try to combine the two.